All right, let's jump into some segments. So going from camping and drinking in state parks, we're going to dive into breast augmentations.
That's a natural transition.
Yeah, it's a normal transition. So this is a segment that I got from people asking me questions on some of the posts we made, just about some general tips if you're thinking about getting a breast augmentation. And just to kind of mix this up, because I think I've done something similar like this in the past, maybe not exactly like this. I wanted to do this in the format of, these are questions you should ask the plastic surgeon that you go to, that you're having your consult with. And I wrote down all these questions to kind of maximize patient information about the procedure and patient safety.
Yeah.
So, and Sarah, weigh in on any of these, because I know, you've talked about this, so I'm not putting you on the spot, that you have done this before and you've had the consults and stuff. Not me, but other people. So the first one that I would think is probably absolutely the most important, I know Sarah knows what I'm about to ask, is ask your plastic surgeon if they're board certified by the American Board of Plastic Surgery, because there is a big problem in the United States with non-plastic surgeons doing breast augmentations, and without question, the outcomes are not as good. If you have a medical doctor doing breast augmentations in their office, they're not going to do as good a job as a plastic surgeon. I can tell you that 100%.
Right.
And it can be very deceiving, because websites will say they're certified by the American Cosmetic Surgery Board, which is a totally fake board. It doesn't exist. I mean, it exists, but it's not considered legit. And so it can be confusing. So I think that is, number one, the most important question.
Got it.
The next one is, I think it's totally fair to ask somebody, how many breast augmentations do you do in a month?
Yeah.
I mean, and the reason I say that is because plastic surgery is very, very broad. You know, there are people out there that may only do like one breast aug every, few months.
So go to a surgeon that their specialty.
I mean, I don't want to say that, because
specialists.
that's my specialty, and I hate to say that because I'm trying to get people to come see me, but there is some truth to the fact that plastic surgeons do tend to specialize. Some do.
Well, I mean, it's like any other surgery. You're not going to go to a foot doctor to go get your heart surgery,
Right, yeah. Well, and in this instance, it's a little different, because any plastic surgeon should be well-trained enough to do a good breast augmentation. But I do think that there will be a difference in outcome for somebody who does 50 in a year versus 4.
Right.
And that does exist. I mean, I do tons of implants. I don't know how many I even do in a year, but I mean, I do at least one a week, and sometimes more, 2, 3. There are people out there that may do one every couple, 3 months, and so it's worth asking. I mean, they may say I only do one every 3 or 4 months, but you look at their results. And,
what's the busy season of getting a boob job?
For me, well, in general, so my busy times of the year are starting right now through about June.
Okay.
So early March, April, May into June, and then fall.
Okay.
Summer, people are traveling, so the people don't get plastic surgery as much.
And they want to show.
And they want to have their body by then.
Yeah.
And then for some reason, things die off in January. This January, I was pretty busy because we had a lot of overflow from December, but historically, January is kind of slow. Yeah. So there is seasonal for plastic surgery, which is odd. The next one, this one is one where you're kind of getting into some of the more technical, is ask your plastic surgeon what implant is right for me and why. Now, if you've done any research on breast augmentation, you will know that there are tons of implants out there. There's saline, there's silicone, there's round, there's shape, there's smooth, there's textured, there's soft gel, there's firm gel. I will tell you that in my practice, probably 95% of the time, I use smooth, round, silicone gel, high-profile implants.
Okay.
That is the best for most people. And it's not, I don't use that because I'm lazy or I don't have I have every implant known to man at my disposal because I use so many through the company. But for most people, that is the best, but not everyone. And
Okay.
I just did one the other day that a girl had a very specific request, and we used an ultra high profile, slightly firmer gel implant. And for her, it was perfect. She loved it, and it did exactly what she wanted to do. But I think it's worth talking to the surgeon about, for what I want, what is the best implant for that?
Mm-hmm.
And if they're not willing to talk to you about that or give you the information, go elsewhere. I mean, you don't want to go to someone that's just going to be like, this is what you're going to get and you're going to like it, Yeah.
Makes sense.
Yeah. So I think it's worth asking about that. Next would be, what are your thoughts on the size that I want to go to? So that's me as the person, having the consult, saying, what do you as a surgeon think about what I want to do?
Yeah.
Because, it's important. I get a lot of people coming in that want to do something that I think is probably not in their best interest. And I'm pretty open about telling them that I think that's a bad idea.
Yeah, I think I've said this before. Like the surgeon I went to, granted, I was really young, so I think he was like used to hearing girls my age being like, I want this, like, you know, some like absurdly large size for my body type. He literally, before I could even say what size, he told me he would go no bigger than X, Y, Z. Yeah.
Oh, I don't know if I knew that. That's actually good.
He was like, I'm just going to tell you right now, before you even say what size you want, I will not perform surgery on you if you want any size crazy. Bigger than what I'm going to.
And I
offer.
do the same thing. I don't like come out and say that aggressively. Well, I don't know if he said it aggressively, but I don't come out and say it like you said. He
couldn't
said it.
have because he had like a little Irish accent. It was cute.
Top of the morning to you. I won't be doing them large implants.
It was pretty much just like Mrs. Doubtfire.
Dr. Hermann, I do have a question. So when you tell people you don't think that's a good idea, what is the percentage of people who say, I still just go ahead and do it? Or like
almost all of them.
You
mean that go ahead and do what they wanted to do?
Yeah, they'll go ahead and do it, or they take your advice.
Most take my advice. Some will not. And then it comes down to...
And then they have to go to a different surgeon, though.
Well, it depends.
Usually.
If somebody wants something that's just totally insane, I'll just say, look, I'm not going to do it. And I've had people get mad at me. Like, they say, well, you're just a bad surgeon. I'm like, whatever. Like, you can think I'm a bad surgeon and just get out of my office. I mean, you know, but I've had people get, like, angry at me. And I'm just like, look, it's all about safety. And I'm not just saying this because you have to do what I want to do. But then on the other hand, if somebody wants to do something that I don't necessarily agree with, but I think is still safe, I'll do it. And that usually comes down to people wanting big implants. There is a limit to what I'll do. If somebody comes in and asks for 800cc implants for cosmetic, I'm just like, absolutely not. But like if somebody wants, say, 500, 550, which I don't necessarily recommend, and if I explain that to them, that these are the reasons I don't recommend it, and these are the risks that you're going to assume by doing it, and they say, I understand that, but I still want it, I'll do it.
Okay, right.
Yeah. Well, I think if anybody has any type of empathy, they'll understand that, like, when you perform surgery on people, it's like you're putting your name on them.
Totally.
Like, when they walk out the door, it's like you want to be proud of it. So I feel like if anybody has any type of empathy, should understand that.
I'll be honest with you guys, I've gotten burned a time or two where somebody wanted something I didn't recommend, and they said, oh, I understand the risks, and I still want to do it. And then one of the risks that I said might happen happened. Yeah. You know, and I mean, that's frustrating. And everyone's been pretty cool. Like, no one's like got mad at me, you know, because, and this usually revolves around big implants, you know. Yeah. No one's like gotten mad at me, but it's just kind of frustrating, you know, when you're like, oh, hey, this might happen, and then it does happen, and it's like, oh. And you have to go back and do another. Yeah, you have to go back and do another surgery. And I generally don't charge people I pretty much never charge people. If someone has surgery with me and they go back to surgery, I don't charge them anything. Okay. But that takes up my time, right? You know, and thankfully it's very rare that happens. But it's kind of a bummer when it does. So asking the surgeon about the size, I think, is important. And another thing is, as a sub-note to that one, is ask the surgeon, how are you going to ensure that the size I want, that I'm asking for, is what you're going to do? Meaning, if Sarah comes in and says to me, Dr. Hermann, I want a D cup, and I say, okay, I'm going to give you a D cup. How do we know we're on the same page with what a D cup is? Because breast cup size is arbitrary. Yeah. You know, if Trey and Sarah and I all had a lump of clay and we were all going to make a D-shaped breast, I guarantee you those things would look way different.
Every time I go to Victoria's Secret, they say I have bigger boobs, and my
that's a marketing thing.
Yeah, I know.
Yeah, that's marketing. Yeah. Well, what I mean by marketing is
that's why I don't go there.
If there's multiple bra companies and a girl is a C cup, C cup, C cup, D cup, that girl will buy that D cup bra in Victoria's Secret every single time.
Because they want to be bigger.
They want to think that they're bigger, right? Yeah.
Yeah.
Wow.
I know, right? Smart marketing. So the way I do it is I have gel sizers I use, and then I have the girl wear a special bra. They put in the gel sizers. It makes them look like they had an augmentation. And when I say, this is what I want, I measure that. And all I do is I write down the measurement. And when I go in the OR, I recreate that.
That's cool. I don't even remember if I did that or not.
Yeah.
At my place.
There are so many people I see come to my office.
It was a very long time ago.
Yeah, it's been a while. There's so many people that come to my office for visionary breast augmentation surgery that say, this is not what I asked for. It happens so much. And so I think it's really important to prevent that. And so there are ways to do it if the plastic surgeon is a good plastic surgeon. Another one to ask your surgeon is, where do you do your surgeries?
Yes.
You'd be surprised how few people ask me that. I do get it every once in a while, and it's not something I always remember to tell them. The reason that's important is there is a difference between getting plastic surgery in a surgery center that is accredited, that is licensed, that is has oversight, and doing plastic surgery in an office. And I'm not a big fan of doing plastic surgery in the office, and I will say that there are plenty of great plastic surgeons that operate out of their offices. There are plenty of bad plastic surgeons that operate out of their offices, and not as many that operate out of a surgery center because of the oversight.
Okay.
The surgery center won't allow a surgeon to do something that is clearly against the standard of care, but in an office, people can do whatever they want.
Right.
And so, like I said, it's not terrible if a plastic surgeon operates out of an office. They could be excellent, but it does give a little bit of potential for downside.
Yeah, some gray area.
Yeah. Another thing that is important to ask is, does anyone else do part of the surgery? Now, did you guys know that a lot of plastic surgeons hire a non-surgeon to do part of the surgery?
No.
Yeah, it happens quite a bit. In order to do more surgeries in a day, some plastic surgeons will hire a nurse or a first assist to do things like the closures. They wouldn't generally be doing the bulk of the surgery, but they do kind of the end parts of it. I don't do that because I'm OCD. I can't have someone touch my work. It's like if, a painter had someone come in and finish the painting.
Right.
Absolutely not. For me, I just can't do it. But that does happen a lot, so it's worth asking about.
Yeah, I knew that they did that for surgeries. From watching surgery TV shows, they're like, all right, the doctor's done doing the hard part, and then they're like, all right, sew her up.
You're up. It's your turn.
Yeah.
Another good question is, what are the costs if I need surgery for a complication? And we were just talking about that, for me, where I don't personally charge people, but then there are OR costs. So it's good to know, and hopefully, complications are very rare, but it's good to know if you do have to go back to surgery, what is that going to cost you? Is the surgeon going to charge you something? Is the facility going to charge you something? And that way, if it does happen, then you're not surprised. Asking about post-op instructions is always important. Hopefully, they're going to tell you that ahead of time. It's just so that you're prepped for it. Really, at least for me, the two big ones are wearing a sports bra 24/7 for a month, and then also no exercise or heavy lifting for 1 to 3 months. So someone like yourself, that's a big workout person, if you go get a consult and they don't mention about their post-op instructions, and then you come back, a few days after your surgery, and you're like, well, can I start going back to working out?
Yeah.
And they say, oh, no, sorry, it's going to be 3 months. You may not be prepped for that.
Yeah. So, I definitely remember wearing a sports bra. I wore one that had the clips in the front.
Yeah, that's the best ones because it's easy to get out of. Yeah, you have the right ones. Another one is, how often do you see complications with breast augmentation? I think it's totally fair to ask someone that. Some patients may feel like you're going to offend the doctor. I mean, if you offend the doctor by asking a question like that, then you need to get out.
Yeah.
I mean, I love when people ask questions. I mean, to me, that means that they're involved in their own care and they're more likely to do the things that I want them to do to get through it.
Yeah.
So I think it's totally fair to ask about complication rates. They're going to say it's low, but at least ask them, what do you see? Number one will be scarring. That's the biggest risk far and away with implants, but it's good to ask about that. And they should volunteer that information to you, ideally. But
yeah.
And then probably the final one is, if a patient needs a lift, to go into detail with the doctor about, do you need the lift or do you not need the lift? Because your case where you went and did it before having kids is not the norm.
Yeah.
Most augmentations are done on women after they have kids. And so a lot of those women, will have some sag in their breasts, and it can be very hard for the patient to know if they need a lift or not. And so you have to rely on your surgeon to give you good advice. And I've seen people get bad advice. I've seen plenty of people that needed a lift get talked into just doing implants, and then they're just not happy because the shape isn't what they want.
Right.
So that's something that's worth diving into if you feel like you have any sag to your breast. So yeah,
those are some good questions.
They're good questions. So I just want to recap this segment real quick. So today on the talk, we were talking about tips for having breast augmentation surgery. So I went through a lot of questions that you would be beneficial to ask your surgeon about, asking about their training, where they do their surgeries, what the specifics are for the plan for you for the surgery to get the result that you want. I do think communication is very important, and so either your surgeon telling you these things or you asking those questions is so important. So if you want to learn more about that, please check out our segment on tips for having breast augmentation. I think there's some great information in there. So
For sure.